My name is Jose Gomez. I am the medical director of Lakeland Center for Wound Care and Hyperbaric Medicine, and we are practicing in Niles. My background is family medicine, but I did a fellowship in undersea and hyperbaric medicine. Well, I am originally from Peru, and I studied medicine in Mexico. After I finished my medical school, I went back to Peru, and I was working in Mission Hospital. It was a missionary hospital in the Amazons in Peru. After a few months, I decided coming here and taking the boards. Before studying medicine, I was studying theology because in my heart, I have the desire for helping my community and my neighbor. When I was in the third year of theology, I realized that I was limited to the spiritual side of my community, and I want to go more. That's why I decided going to the physical side. And that was the reason why I changed from theology to medicine. Well, the language that I speak are Spanish, Portuguese, and English. I was born and raised in Peru, and I have the opportunity of doing a one-year internship in Rio de Janeiro in Brazil. So that was the time that I learned Portuguese. I have three beautiful daughters and one beautiful wife, and most of my free time and my hobbies is spending time with my family and doing camping. This is one of the most beautiful experiences that we have with my family. My daughters are happy going to camping, and my wife started liking going to camping. I started working with Lakeland since 2006. It was in November 2006 when I started working with Lakeland. I started working in Family Care of Niles, and I was going to the wound clinic one day per week. In 2009, I decided doing a fellowship in undersea and hyperbaric medicine, and since 2010, I started doing a full-time job with a wound clinic and hyperbaric center. And I think that the most satisfying part is just seeing healing wounds that you see that for years and for months doesn't heal. I think that's the most satisfying part of my job. What we try to teach our patients is how to prevent the wounds and how to heal the wounds. Remember that the cells, any cells of your body need oxygen for healing, working properly, and reproducing another cells. If the levels of oxygen are decreased, the function of the cell are affected. So we try to teach the patients that no matter if this is an arterial wound, if this is a pressure sore, or the patient is diabetic or is venous stasis and there is more edema on the leg, the blood flow to the skin and to the wounds are going to decrease. If we resolve those problems, so we need to do an extensive vascular study to see if there is any occlusion of the arteries. We need to teach the patient that it's important repositioning very often so the blood flow to the wound and the pressure area improve. Or if the leg is too swollen and the microvasculature and the blood flow to the skin is decreased, is the cause of the wounds. Having wounds is no easy thing. Most of our patients have wounds for a long time. And if they come to the wound clinic looking for help, maybe it's the last resource that they have for looking for help. We have to understand that they are very anxious. And I think that the most satisfying part of my job is just seeing the improvement of the wounds. From time to time, we have patients who come to the wound clinic and they say that the surgeon and the doctor recommend having amputation. Most of the time, that's an appropriate treatment, but they want to go the extra mile. They want to see if there is any other alternative treatment for saving the limb. And it's a great satisfaction when we see cases that we were able to help them and prevent amputation. My name is Jose Gomez. I am the medical director of the Lakeland Center for Wound Care and Hyperbaric Medicine. Mi nombre es Jose Gómez. Yo soy el director médico de la Clínica de Heridas y Medicina Hiperbárica de Lakeland Hospital in Niles.